Hello, good evening. We are doing the pathAnatomy series, KROK-based 2015. So the first question is, the intraoperational biopsy of a mammary gland has revealed the sign of atypical tissue with disorder of parenchyma stoma proportion with the domination of the last. The gland structure of different size and shape lined with a single layer proliferative epithelium. What is the most appropriate diagnosis? And here is the five options: the infiltrative cancer, fibroadenoma, mastitis, papilloma, and non-filtrative cancer. And the answer is fibroadenoma. So what we have to mark here, the disorder of the parenchyma and the stoma proportion and the gland structure of different size and shape, and it is lined with a single layer proliferative epithelium. So first of all, we will take the fibroadenoma. From the fibroadenoma, we will take the adenoma. And what is adenoma? Adenoma is a benign tumor from a glandular epithelium, and it has a seven morphological variants of these kind of adenomas. The first one is the acinar or the alveolar adenoma. Second one is the tubular adenoma. Third one is the trabecular adenoma. Fourth one is the solid adenoma. Fifth one is the papillary cyst adenoma. Sixth one is the villiferous adenoma, and the seven is a fibroadenoma. So we are let's forward our discussion about the fibroadenoma. Fibroadenoma is a benign tumor. What is it's a benign tumor with a well-developed stroma and poorly expressed parenchyma. So we will find there that the atypical tissue with the disorder of the parenchyma and the stroma proportion. So from here we will find that the stroma is more prominent than the parenchyma. And that's why we say that the well-developed stroma and poorly expressed parenchyma. And fibroadenoma is an organ-specific tumor of a breast. Fibroadenoma is frequently occurring benign breast tumor in a woman aged 25 to 35 years old. In pregnancy, it usually increases. Why? During the pregnancy, the chances of the fibroadenoma is increases because the fibroadenoma have a special type of receptors to the progesterone, and during the pregnancy, the progesterone level is very high, and these progesterone maintain the pregnancy as well as it regresses with the age. Okay, fibroadenoma we will find rarely malignancy, only 0.1% of the patient, and in most cases carcinoma in situ is detected. So what is carcinoma in situ? Carcinoma in situ means like in one place there is a development of some tissue abnormal cell in a particular site, and these abnormal cells are increased or in their size and shape there. So after that, these abnormal cell changes into cancers, and it slowly spreading in the different sites. So this is called carcinoma in situ. What we will find in the macroscopically in the fibroadenoma, we will find these fibroadenoma is thick and movable, painless, well circumscribed white nodes. Usually, if we see the diameter of this fibroadenoma is no more than 3 centimeter, and we will see a white slit-shaped cavities on the cut. Sometimes it can reach a large size and it form a giant fibroadenoma. So the tumor is composed of glandular structures, ducts. Okay. So the different types and size. So glandular structures, ducts are different size and shape, as it is mentioned in the question. The epithelium lies on the basement membrane, maintain its polarity and complexity. So stoma is represented by a large amount of connective tissue, often loose or rich with cells, which dominates the parenchyma. So in the question, there is mentioned that the disorder of the parenchyma and stroma proportion. So here we will find the stroma is more prominent with the comparison to the parenchyma. So there are two variants of these breast fibroadenomas. One is called intracanalicular adenoma, and another is called pericanalicular fibroadenoma. Okay, what is intracanalicular adenoma or fibroadenoma? It's a stoma grows in the ducts. Within the ducts, the stoma grows, and these adenomas compress them and giving them a bizarre slit-like shape. Stoma is often loose and rich with this cell. What is pericanalicular fibroadenoma? It means it grows around the ducts. Fibrous stoma grows around the duct, so they have the form of small round tubules. Often both variants are found in the same tumors. Basically, we will see that intracanalicular fibroadenoma or adenoma present sometimes present pericanalicular fibroadenoma, or sometimes both intracanalicular fibroadenoma or pericanalicular fibroadenoma present in the same tumor. Thank you.